Thank you for watching this YouTube video, which reflects the research project entitled Examining How the University of Western States Prepares Doctor of Chiropractic Candidates to Practice Cultural Competence and Cultural Humility. My name is Majekobaje, and this was my final project on my way to earn a master's degree in educational leadership through San Diego State University as part of an all-Palauan cohort that started in 2020. The research question that guided the study is, how does the Doctor of Chiropractic program at the University of Western States prepare students to be professionals who practice cultural competence and cultural humility? For many health professions in the United States and around the world, cultural competency and cultural humility are an important aspect of professional development so that healthcare workers, in this case, chiropractic physicians, can provide the best customer service and get the best healthcare outcomes possible. In my research project, I use these terms together and have labeled them as CCH because both concepts have value based on the literature and best practice. To define these terms, cultural competency is the ability to effectively interact with people from cultures different than one's own, especially through knowledge and appreciation of cultural differences. Cultural humility is a lifelong process of self-reflection and self-critique whereby an individual learns about other cultures and groups and examines their own beliefs and cultural identities. It also requires addressing the doctor-patient power imbalance, and it values community-based learning and partnerships. To give some background, UWS is located in Portland, Oregon, and offers 6 professional health science degrees, including their flagship program, Doctor of Chiropractic. I wanted to provide some context about why CCH is relevant to chiropractic education and University of Western States. We've all heard that the U.S. has grown in its diversity, and that by 2045, the Census Bureau tells us that the majority of folks in the United States will be considered people of color. Meanwhile, chiropractic is the least diverse of all the health professions except for veterinarians. In addition, and unfortunately, health disparities continue to persist in the U.S., especially for communities of color and low-income people. After the murders of George Floyd, Breonna Taylor, and others, students and other stakeholders on the UWS campus called for UWS to live their commitment to diversity, equity, and inclusion. Furthermore, students and other stakeholders have an expectation of social justice, and the calls for justice have just become louder. Case study was chosen as a research methodology to provide a detailed, multi-perspective picture of the DC program in the context of CCH. According to Yin 2015, case study is a suitable methodology when one is asking how and why questions. In my case, I am asking how questions. How does UWS prepare students? How does a particular course prepare students? How does the clinic prepare students? How? The second scenario in which case study is appropriate is when, as I mentioned, one wants to do a deep dive into an issue or phenomenon, in this case, CCH. There are many case study best practices, but the number one best practice, according to Yin, is that you can't have just one source of evidence in case study, and that you really do need more than one perspective. Because of this, I identified 3 sources of evidence for this study that started with conducting faculty interviews. After seeking approval from the UWS Institutional Review Board, I identified a key informant to initiate the snowball sampling method of purposeful sampling. 6 subjects out of 37 full-time faculty were ultimately identified based on recommendations from previous subjects. I then conducted 1-hour semi-structured interviews with each subject that included 7 questions with follow-ups. 5 interviews took place in person, while 1 was conducted via using web meeting software. Each interview was electronically recorded. The second data source was a document review of DC course syllabi. During the faculty interviews, subjects were asked, are there specific courses that cover CCH topics, and can you list up to 5 classes that you think I should review? In total, 18 courses were recommended for review out of the 113 courses, or 15.9% of courses. A request was sent to the UWS Academic Affairs Office for electronic copies of each course's associated syllabus. For the third source, I wanted to look for relevant data in the July 2022 Graduate Survey Outcomes Report, an electronic, mostly quantitative survey sent to graduates at the end of their Doctor of Chiropractic program. A request for this report was sent to the Institutional Review Board, and an electronic copy of the report was provided to me. To analyze the interview data, I took the recordings from the 6 interviews and had them transcribed using Temi.com, which is a low-cost artificial intelligence web-based software. I printed the transcripts out and read them over and over and over, and then I uploaded them to taget.com, where I used open coding to create codes and then tag those codes throughout the document. From there, I looked for patterns, I consolidated the patterns, and then I thought for a really long time until themes began to emerge. In terms of data analysis for the course syllabi, I used a document protocol that I created, and I reviewed each of the 18 course syllabi for keywords and concepts related to CCH. Similar to the data analysis process with the interviews, I looked for patterns and themes that I would eventually be able to compare to the themes from the qualitative interviews. Lastly, for the third source, the Graduate Survey Outcomes Report, I reviewed the report to identify any questions related to concepts of CCH. The UWS Institutional Effectiveness Office had already completed descriptive analytics of the data. I identified 3 questions relevant to CCH. These questions and student responses were extracted from the report and analyzed in relation to the research question, and then themes from the 2 other data sources. As the final part of my data analysis, I listed all the themes and examined which sources of data shared similar or dissimilar themes. One researcher calls this a convergence of evidence, in which shared themes and patterns emerge, or in other words, being able to corroborate data from different sources. So for this, I'm going to move to the other side of the screen. As a result of the data analysis, 7 themes resulted with some subthemes. These themes included 1, students observing clinicians treating patients, 2, messaging about why CCH is important, 3, experiences and characteristics of specific groups, 4, active or experiential learning, which actually had 2 subthemes, 1, in-class active learning, and 2, community-based experiential learning, 5, self-reflection about personal and professional identity, 6, acknowledging the power differential between patient and provider, and 7, opportunities for improvement. And opportunities for improvement actually had some subthemes as well. The first is insufficient preparation, the second was lack of strategy or happenstance, and the third was limitations of the literature. That 7th theme was really found to underpin all of the other themes. The faculty interviews were really the foundation for the findings, and so accordingly, all the themes were present in the faculty interviews, as you can see here. The document review of syllabi found that 6 of 18 syllabi had at least one mention of a CCH concept. This also meant that 67% of syllabi had no mention of CCH keywords or phrases. Of those syllabi where CCH was discovered, keywords and phrases were found in various locations, including the course description, the schedule of weekly topics, course objectives, and the recommended resources section. Keywords and phrases from the syllabi were then matched with previously identified themes, as we see here. The graduate exit survey report had 3 questions relevant to cultural competency and cultural humility themes. The first question focused on student feelings of preparedness to provide culturally responsive care. The second question asked about student ability to develop management strategies for a diversity of patients. And the third question asked about student ability to communicate across differences. For each question, over 96% of students responded positively, meaning they either strongly agreed, or slightly agreed with the question. For each question, less than 4% of students responded negatively. From this chart, you can see that theme number 3, experiences and characteristics of specific groups, had convergence from all 3 data sources. There we go. In theme number 7, opportunities for improvement, the faculty subjects had totally different perspectives from the students. The original hypothesis of this study was correct in that the researcher hypothesized that the study results would show the DC program's strengths and areas of growth. It is clear that students are receiving some training around cultural competency and cultural humility. This was reflected in what faculty said in the syllabus and from student reports of being prepared to practice CCH. At the same time, some subjects stated that there is a lack of strategy at the university to implement CCH. There are gaps in leadership and a lack of knowledge of how to integrate these topics into their courses. Most faculty expressed that UWS is not adequately preparing students to practice CCH, and the syllabus review process confirmed that there is limited evidence that CCH is being taught across the curriculum. In terms of additional discussion points and conclusions, perhaps the 7 themes that resulted from the study can be a roadmap as the DC program continues its curriculum review process that has been ongoing for the past few years. In addition, there is very little research that pairs chiropractic education with cultural competency and cultural humility, and other diversity, equity, and inclusion topics. This study has the potential to add to that body of literature. In terms of recommendations, it is recommended that these results are shared with key leaders in the chiropractic program to create a strategy and pathway for students to obtain CCH training. I also recommend that course designers work with faculty to examine how CCH topics can better be reflected and integrated into course syllabi to ensure that CCH is being taught. Finally, it is recommended that the clinic examine the theme, students observing clinicians treating patients, and have a conversation about how to be more intentional and explicit about the values being taught to students related to inclusive patient care. To explore how the University of Western States prepares its Doctor of Chiropractic candidates to practice cultural competence and cultural humility, this study used case study methodology to create a multidimensional picture of how students are prepared. The investigation showed that UWS prepares students using a variety of different strategies, but that each strategy has areas of improvement in order to create a more consistent experience for students. As the DC program reviews and revises its curriculum, this study can provide baseline information about strengths and gaps concerning CCH and can be a roadmap to meet future accreditation standards. Among other things, the researcher recommends that the study's result be shared with key stakeholders and leaders to create and implement an effective CCH strategy. The limitations of this study include the short time frame for conducting and analyzing the research. In addition, the study's investigator plays a key role in facilitating and leading diversity, equity, and inclusion efforts on campus, and that role may have brought some bias to the research project. Third, the data source graduate student survey report had limited data relevant to the research topic. I would be remiss if I didn't acknowledge that so many people helped me get here, including Dr. Lally, Dr. Navarrete Garcia, and the other amazing faculty from the program. There's my family who took on parenting roles when I was doing homework, my colleagues who are always there to help, Ngara Klamat, and the rest of the Palau cohort, Mrs. Parentozzi, who kept us connected to the end goal and to each other, and my 2 kids and husband, who are my inspiration. Of course, President Tilley and Dean Sherman, who allowed me to be a part of this program, and to SDSU and President De La Torre and other SDSU leadership. Thank you for supporting the educational needs of Palauan students.